Thank you, Dr. Seetharamu. That was a great presentation. And now I'm going to move forward with our next presentation with diversity and lung cancer care and achieving lung health equity. I want to thank everyone for the opportunity to showcase the work that the American Lung Association has been doing with lung cancer and achieving lung health equity. So I stated before, my name is Annette Eyer, and I'm the National Assistant Vice President of Patient Engagement with the American Lung Association. Since the inception, more than about 115 years ago, the American Lung Association has been advancing health equity to reduce the burden of lung disease on those most impacted. From our beginnings in stamping out tuberculosis to smoke-free air advocacy to our current COVID-19 pandemic, the Lung Association has always strived to protect those most vulnerable populations. We work with state governments and cancer care coalitions to prioritize health equity with strategic plans and implementations. This includes lung health initiatives that impact lung cancer patient outcomes, such as cessation, access to care, COPD comorbidity, and comprehensive data collection and analysis to be inclusive of all communities. As shown on the chart that I have above, the social determinants of health, we know that conditions in the places where people live, learn, and work affect a wide range of health risks and outcomes. The American Lung Association strives to address all the social determinants of health in our everyday efforts and to improve lung health and prevent lung disease. And we do that through 3 avenues. We do that through education, advocacy, and research. And today I'm excited to take the opportunity to share with you some of the highlights of the programs that we are doing around education, advocacy, and research. As our esteemed panel of professional doctors this morning talked about, is the thing that's the overriding message that Americans need to know is that anyone can get lung cancer, and there are multiple risk factors. As noted earlier, the #1 risk factor for lung cancer is smoking. The #2 risk factor is radon. But exposure to particle pollution, exposure to hazardous chemicals, and genetics, they are all potential risk factors of why people get lung cancer. We know that lung cancer is the leading cancer killer in the United States, and some communities bear a disproportionate burden from lung cancer, such as Black Americans and those with lower socioeconomic status. We also know that smoking is the leading cause of preventable death in the United States, and some communities endure a disproportionate burden from tobacco use, such as the indigenous people, American Indians, Alaska Natives, Black Americans, LGBTQ+, and those with behavioral health and substance abuse issues and lower socioeconomic status. We work with trusted community partners. We know that the best practice in educating disparate affected communities is to work with individuals in their organizations and people that they trust. So when we do our work with low-income and rural communities, the cultural norms favoring tobacco use are prevalent in certain areas, including states with historical ties to tobacco cultivation. Low-income and rural areas face additional challenges in form of their local challenges in the form of local healthcare provider shortages, less education, and elevated risks of the uninsured. So some of the things that we have been doing is we work with a nationwide program to create a patient pathway workflow that we work with public housing authority staff and residents to help them navigate through cessation resources that the American Lung Association provides. And we also are piloting a program in Pennsylvania for telehealth for a predominantly Hispanic population, so they really can have the same resources that are available to in-person visits. The program that we talked about is education and awareness. And again, I'm just going to highlight just a few of the things that we have done to show the importance of education. In partnership with the Ad Council, the American Lung Association launched the first of its kind. It was a national lung cancer screening campaign called Saved by the Scan. And that was launched on World Lung Cancer Day in 2017. And the goal of that campaign, again, as I said, this was focused on the #1 risk factor for lung cancer, which that target audience was former smokers. And our goals were to raise awareness of the benefits of early detection through lung cancer screening. We were driving individuals to take the lung cancer screening eligibility quiz and have former smokers ask their doctors about their lung scans. And we targeted high-risk populations. And the call to action for this campaign was very simple: talk to your doctor, and learn more at Saved by the Scan. So I want to show an awesome video by one of our Lung Force heroes, Millie, who her life was saved by seeing this ad campaign that's, as we talked about, so critical to have people become a part of it. So I'm going to share this screen.
Not only did Saved by the Scan save my life, Saved by the Scan gave me a new voice. I heard church bells ringing. I heard a choir singing. I saw my love walk down. I was a 45-year-long smoker. I never thought I'd get lung cancer. My mother had passed 20 years ago from lung cancer. My brother, 19 years. They were both diagnosed at stage 4. So their longevity, their lives were cut short. But I never thought I'd get it. You know, you never think it'll be me. So one day I was watching television and I saw a public service commercial that advertised early detection. And I listened really closely and I found out that I might meet the criteria. So I visited savedbythescan.org. I actually took a little quiz to see if I would qualify for this early detection low-dose CT scan, and I qualified. So I got in touch with my doctor. In May, I got the results back. I had lung cancer. Not only did I have lung cancer, but it was a huge 6-centimeter mass in my upper right lobe. I was so scared I wouldn't be able to sing again. I was so scared that it had spread somewhere else. In June, I had the right upper lobe removed. They took out 17 lymph nodes, and they were all negative. The margins around the cancer was negative. So I ended up having stage 1 lung cancer. I discovered that not only did Saved by the Scan save my life, Saved by the Scan gave me a new voice, you know, because I stopped smoking. I no longer smoke. My family, my son, my daughter-in-law, all smoked prior to my diagnosis. We've all quit smoking. It's been over a year.
It feels great to have my mom back, doing what she loves to do. It makes everyone happy, it makes us smile, it makes her grandkids smile, and it feels like we've just climbed the biggest mountain that we ever could. So with that said, I mean, we can accomplish anything.
To have an opportunity like this to continue not only my life, but maybe provide enough information that someone else's life can be saved. I'm a very emotional person, but this emotion is joy because I've been given another chance. I sing because I'm happy. I sing because I am cancer-free. Saved by the Scan saved my life.
That campaign has been very successful, and since 2017 we've had more than 430,000 people take that quiz, and it resulted in a 58% increase in awareness of low-dose CT scans among former smokers. This is just one of the campaigns that we've done to really kind of raise our visibility about the importance of early detection. The other campaign that we've done is we have a group of 24 individuals who serve on our lung cancer patient advisory group. And they are a group that really helps us gauge the messaging and the information that we put out to make sure that it's appropriate and it's talking to what lung cancer patients and survivors and caregivers want to hear. And so this program it's a pilot program. We're hoping to launch it nationwide, but right now it's very small. But what it is one of our lung cancer heroes, Pam Mercer, she lives in Arkansas. And Pam lost her husband several years ago to lung cancer. And 3 years after he passed away, Pam herself was diagnosed with lung cancer. And so she has obviously a very broad perspective from a caregiver and a survivor perspective. And she said the one thing that she wished that she would have had was when her husband got his diagnosis and she got her diagnosis, that they were just so overwhelmed with information. You were told you have lung cancer, and then you're handed a folder with all these papers of your insurance company and questions to ask your doctor and who to look for, and it was very overwhelming. So through the help of this panel of 24 lung cancer patients, we created a Courage Kit, and in that Courage Kit has everything that they wished that they had had. It has a one-stop shop guide. It tells you everything from potential treatment options to talk to your doctor about, has a medication tracker, an appointment tracker, and it really gives you all the resources that you want to know and where to start. It also has a blanket, because when you start your chemo or your radiation, and you're there for a long time and sometimes it's cold. And the big key is a lot of lung cancer survivors have taken to journaling. And so we've created a journal for them that they can really talk about and write down what they're feeling and their thoughts. So this is a project that is driven by our patients. And for any lung cancer patients that are out there watching this program today, we'd love for you to join this pilot. And we do have the link on the screen and we can send it out to you. Please reach out to us. We'd love you to participate in our Courage Kit pilot program. The other campaign that we did was based on Radon Awareness, which is the second risk factor for why people have lung cancer. And this is a campaign that we partner with the Illinois, it's in Illinois, it's a radon video contest that we do with youth. It's held every year to spread awareness on the dangers of gas radon. The Illinois Radon Video Contest is made possible through a partnership that we do with the U.S. Environmental Protection Agency and the Illinois Emergency Management Program. I'm going to show this video.
What's your radon?
Odorless, colorless, tasteless. Radon is the #2 cause of lung cancer, killing 21,000 people every year. And it could be in your home. New homes, old homes, it doesn't matter. There's no safe level of radon exposure. Protect your family. Test your home.
To find out more, go to lung.org/radon.
What's your radon?
The next piece that we want to really go into is our lung cancer research program. You know, research is the key to new discoveries in lung health, and over the past decade, strides have been made in lung cancer treatment and care, and personalized treatment is advancing thanks to the biomarker testing and targeted therapies. New methods of early detection with low CT scans may increase the chances of survival for individuals at high risk, but still we need to know more what research is out there to really defeat lung cancer. Our funding research is critical, and it's a critical part of what the American Lung Association work that we do. We support a rich array of studies in lung cancer to help develop treatment options and improve methods of early detection. And since 2014, through our Lung Force initiative, we have funded more than 12 million in lung cancer research and research grants and awards. And in fiscal year 19 alone, we provided more than 3 million in lung cancer research funding. We also collaborate. In 2017, the American Lung Association partnered with Stand Up to Cancer and the Longevity Foundation to announce a new lung cancer research awards, bringing together leaders from across disciplines, institutions, and countries to collaborate and move research from bench to bedside to benefit patients more quickly. The Stand Up to Cancer Longevity Foundation and American Lung Association awarded the Lung Cancer Interceptor Dream Team for $5 million, and the Lung Cancer Interceptor Translational Research Team for $2 million. These awards mark the American Lung Association's largest single investment in lung cancer research to date. I'm going to show you a quick video from one of our researchers.
Lung cancer is still the major cause of cancer death, not only in the U.S., but around the world. So the way in which we have the healthcare of tomorrow is to do research today. And we need to tackle those major problems that now seem intractable what will be mitigated by discoveries that we make today. And the opportunities that we have now to really transform the way in which we approach lung cancer will be dependent upon the research we're able to do today. There's no way to do this research without funding, and the vision that our ALA members have to bring together a workforce to tackle these major problems is crucial. There can be no more important work.
The other component that we talked about is access to quality and affordable health care. The American Lung Association develops annual reports on state of the air, state of tobacco control, and state of lung cancer in the United States. These reports provide detailed information that reveal how the federal government and state governments are controlling tobacco and protecting their citizens from lung cancer and polluted air. Lung cancer remains the leading cause of cancer deaths among both women and men in the United States. The state of lung cancer is the American Lung Association's report that shows how the toll of lung cancer varies by state to state. This report finds that over the past 10 years, that the 5-year cancer survival rate has increased by 26%. However, it examines lung cancer incidence, survival, stage and diagnosis, and surgical treatment, lack of treatment and screening. And this report finds that states must do much more to protect the residents from lung cancer. We are excited to say that our state of lung cancer report will be released in November. It's the 2020 report, and it will be released in November of 2020. But really, this is the efforts that we do that helps us drive positive policy change and to improve public health. Some of the highlights of the things that we work on for, in addition to lung cancer patients, but lung disease patients, is we advocate for access to quality and affordable health care for all, and we oppose discriminatory barriers to such care. We want to expand access to health care. We advocate for greater health care coverage through avenues such as the Affordable Care Act. Health insurance through the Affordable Care Act benefits millions of Americans with lung disease and has helped lower the uninsured rate among all racial and ethnic groups. We continue to advocate to maintain the benefits of the Affordable Care Act and increase awareness of these benefits, such as open enrollment among all communities. We will be launching a big campaign November 15th about the importance of open enrollment. Millions of Americans, because of the pandemic, have lost their healthcare coverage, and now more than ever, they need to see what's available to them and what's affordable. So we will be helping people guide that navigation process of what to look for insurance. We also advocate for Section 1557. It preserves the integrity of the Affordable Care Act, which ensures that all communities have access to care by prohibiting discrimination on the basis of race, color, national origin, sex, age, or disability by any programs or activities that receive federal financial assistance. Section 1557 helps protect the health and well-being of all Americans seeking care, particularly those in underserved communities. For public charge, we advocate for the exclusion of safety net programs such as Medicaid from the public charge evaluation criteria. The exclusion of these programs harms immigrants, their families, and the communities where they live. These communities should not be deferred from seeking medical care. Medicaid expansion. We advocate to expand Medicaid expansion in all 50 states. It expands beyond access to lung cancer screening and tobacco cessation treatments and have been shown to reduce racial disparities in access to a timely cancer care. We have a coverage for guidelines-based care. We track coverage for asthma guidelines-based care and tobacco cessation programs and state Medicaid programs for the CDC. This data helps us implement policies that reduce disparities in access to care. Air quality and equity. Our healthy air advocacy efforts to make sure that no community is left out. Environmental justice is the key priority of our Healthy Air campaign, and it is woven through all of our efforts. We do have a great film that we can provide to you. It's called Unbreathable, The Fight for Healthy Air. It recently was released, and it focuses on community, mostly of color, that are still waiting for the benefits of healthy air. The other piece that I want to share is we did typically every year we do a Lung Force Advocacy Day where we take Lung Force heroes from every state, including the District of Columbia, to Washington, D.C. to advocate for lung cancer research and protecting patients with pre-existing conditions. Of course, our Advocacy Day was March 16th. And we did not do that this year because of the pandemic, but we quickly turned and pivoted and made our event a virtual event. And so here's an amazing story that kind of showcases the great work that we were able to do during the pandemic.
Wednesday, March 25th, 2020. It's Advocacy Day! I'm so excited. I have been waiting for this day for so long, ever since I found out I was someone who was going to represent the American Lung Association as a lung force hero to go to Washington, D.C. to share my story on Capitol Hill. Well, as you can see, I'm in Phoenix. I'm not in Washington, D.C., but it's all good. I'm still going to get to do a call-in to the Capitol Hill representatives today, but next year, your girl Diva will be in Capitol Hill in Washington, D.C.
We were allowed to do a remote conversation with 3 representatives, and their offices all listened. And basically, my request for them was to ask them to support $44.7 billion in funding for the National Institute of Health. I also asked that they continued their support for our current healthcare protections, which includes those for people with pre-existing conditions. I had a blast talking to people that matter, and you matter.
I've had some amazing things happen in my life, and I'm so thankful for them. One of them is this, working with the American Lung Association. Individuals like me have a voice. That's why we were invited to share our story on Capitol Hill. We want Congress to know that we are more than just words and statistics on a piece of paper. We are living, breathing individuals who are passionate about living our lives to the fullest. Woo woo! Toot your own horn, honey. Beep beep.
Now I'd like to talk about the amazing lung cancer resources that we do have with the American Lung Association. We encourage everyone to go to lung.org/lung cancer. We have everything that covers lung cancer screening, biomarker testing, coping with side effects, staying organized and prepared. And these are just some of the great programs that we do have. One of the organizational things that we are doing a big campaign is on tumor testing. I'm going to let you hear from one of our doctors and patients about tumor testing.
I was 36 years old when I was diagnosed with lung cancer, and I was told I had about 6 months to live.
When the doctor told me that I had stage 4 lung cancer, it was quite a surprise. I did not expect that answer.
My youngest child was 3 years old when I was diagnosed. To think that she wouldn't remember who I was.
When I was first diagnosed, I was so overwhelmed. I didn't know what to think. I didn't know what my treatment options were, and I didn't even know what questions to ask the doctor.
I was fortunate that my doctor knew about tumor testing, but not every lung cancer patient is that fortunate.
Tumor testing, sometimes known as molecular or biomarker testing, is an exciting advancement in lung cancer. When a tumor is biopsied or removed, pieces of the tumor can be sent to a lab where it can be tested for specific mutations or abnormal proteins that cause the cancer to grow. If your cancer cells have one of these specific mutations, your doctor may recommend a targeted therapy for your tumor.
When I was originally diagnosed, the ALK mutation hadn't been identified yet. Luckily, when the mutation was discovered, my doctor had my tissue retested, and I did have the ALK mutation. I went on a targeted therapy, and it's worked really well for me.
When my results came back, I found out that I tested positive for the EGFR mutation. After starting my targeted therapy, I was no evidence of disease within 8 months. All the tumors were gone. I'm beyond grateful that my doctors ordered tumor testing for me.
Tumor testing and targeted therapy may not be for everyone, but it all starts with a conversation with your doctor.
The The other piece of education that we continue to do is the lung cancer is committed to addressing lung cancer stigma. We have conducted ongoing research to better understand and address the problem. Our program that we did is addressing the stigma of lung cancer. The report synthesizes much of our findings. In order to tackle lung cancer stigma indefinitely, the lung cancer community needs to change the way it talks about the disease. Through our research on stigma, we've identified messaging and suggestions for patients and caregivers and advocates. These guidelines can help communities change the way we discuss lung cancer and in turn, reduce lung cancer stigma. We are all working together to defeat lung cancer. As I mentioned earlier, the American Lung Association launched Lung Force, which unites women and their loved ones together from across the country to stand together for lung health and against lung cancer. Lung cancer is the #1 cancer killer for both men and women in the US, and every 5 minutes a woman in this country learns that she has lung cancer. We all need to do more to raise awareness and research. Funding is needed to defeat lung cancer in all. I'm going to share a story from one of our amazing Lung Force heroes.
I was diagnosed with stage 4 non-cell lung cancer. I have a large support group, and every day when I'm down, I look at it and I know I'm going to beat this. I don't want this. That's not me. The voices need to be out there. And lung cancer, as we know, is not one of the cancers everyone talks about. I feel that with all our voices, it's going to be heard. Met so many people, I'm still in contact with them. And it's great when you could talk to people that are going through the same thing. And it makes you keep going.
That is such a powerful voice from one of our very active Lung Force heroes. And it talks about the value of why you need to collaborate and be together. And so much of our focus with Lung Force is to really help connect lung cancer patients and survivors together. The other resource that we have is on our Inspire community, and it is a very quick, easy one-stop shop with Inspire. The American Lung Association, we support several of these free online communities, but the one for lung cancer survivors, we have over 110,000 lung cancer survivors who are on very frequently, and because we find it very important to host these support communities, because being able to speak freely and trusted with a supporting group can positively impact one's health. So we really encourage you, if you're not on Inspire yet, please go on Inspire, learn more about it, and perhaps find that one of these blog sites might be very helpful for your journey. The other recent partnership that we have is with Immermansangels. And this is one of our Lung Force heroes, Denise. And when Denise was diagnosed, she said that she felt so alone. And in her current hospital system, she really didn't know anyone or was in touch with anyone who had her diagnosis. So Immermansangels is a partner organization of ours, and they provide peer-to-peer support for lung cancer patients, or actually any cancer patients, but ours focuses on lung cancer. And so it's a very easy communication. Go to lung.org/cancer mentor and sign up today. And you can either become a mentor to someone who has lung cancer, or you can receive those very critical services that we have that are so important with your lung cancer journey. The other piece that we do have is that we have our lung helpline. We have it in English and Spanish, and we are there to answer any questions. It's staffed with medical professionals, and so we really encourage everyone to call 1-800-LUNG-USA if you have any questions on lung cancer or any of the programs that I've talked about. We are, in one of the things that I wanted to showcase is we are having a lung cancer patient virtual meetup, and that is on November 10th. That is a free program, and that really was designed to talk about the different treatment options, living with lung cancer during COVID-19, and also lung cancer in clinical trials. So we'll provide that information to you. We encourage everybody to sign up for that program. And in closing, the only thing that I'd like to showcase is some of the work that we are doing. In March and April, we announced that we are going to be launching a COVID-19 action initiative. And we have committed to invest $25 million to end COVID-19 and defend against against future respiratory virus pandemics. We host monthly programs, monthly town halls, and they are of course free. And these are the two that are coming up in November. We have COVID-19 Recovery, the Path Forward, and then our December program is Disparities in COVID-19, Unjust, Unacceptable, and Correctable. So those are some of the great programs that we offer. And, you know, in closing, we do really appreciate the opportunity to be a part of this very important conversation. You know, the American Lung Association, as we make strides towards evolving as an organization, we would like to recognize our new Diversity, Equity, and Inclusion Council. This council will help advance us in our diversity, equity, and inclusion in all of our practices, our programs, and processes throughout the various methods to value all of the American Lung Association staff, volunteers, and individuals in the community we serve. So I encourage each of you to take a moment to go to our lung.org /diversity and meet some of our members and look at the work that the American Lung Association is doing. And again, we do thank you for this opportunity to be a part of this important conversation. And if you have any questions or concerns, you feel free to contact me at Annette.Eyer@lung.org. Thank you very much.